Hello friends, so in this section we'll discuss pulmonary function tests. So I had divided this topic into two parts. So this is the first part. Pulmonary function tests, these can be defined as non-invasive tests, and they tell us about the functioning of the lungs, okay, about the working of the lungs. Now in these pulmonary function tests, what are the things that we actually measure? So we measure lung volumes, lung capacities, flow rates, and diffusion rates. Okay, so these are the things that we look for while performing pulmonary function tests. Now these lung volumes and lung capacities and flow rates, they are measured by an instrument which is called as spirometer. Okay, this is called as spirometer. It's used to measure these lung volumes and lung capacities. There are some exceptions. There are some lung volumes and lung capacities which cannot be measured by spirometer, so we'll get to the exceptions part later on. First, let's try to understand what these lung volumes and lung capacities are. Before that, let me show you this diagram. So this is a person undergoing pulmonary function test, and this device is spirometer, and the person here, he has to blow air into this machine, and the machine records the input and gives appropriate results. Okay, so this is how the result of a pulmonary function test looks like. As you can see, these all are spirometric findings. Okay, so a very important thing that we can note here is that the person has to clip his nose, because when the person blows air into this machine, it's possible that he might blow some air through his nose as well. That would lead to incorrect results. So the person has to clip his nose first so that no air goes out through the nose. Okay, now let's try to understand these lung volumes and lung capacities with the help of this simple diagram. Okay, so on the y-axis there's volume. Okay, so it will show the volume of air that's inspired or expired. Okay, let's say volume of air in the lungs. Let's say we ask the person to inhale normally. Okay, let's say we start from here, from this point we ask the person to inhale normally. So during inspiration the person is going to inhale some air. During expiration the person is going to exhale same amount of air. Okay, this is a normal inspiration or expiration without any additional effort. Again, normal inspiration, normal expiration, normal inspiration, normal expiration. Okay, so this amount, the amount of air that's taken in during normal inspiration, or the amount of air that's expired during normal expiration, this is called as tidal volume. Okay, this is called as tidal volume, and it's about 500 ml. Okay, so the first one here is the tidal volume, which is the amount of air that's taken in during normal inspiration, or the amount of air that's expelled during normal expiration. Okay, this is called as tidal volume, and it is equal to 500 ml. Okay, 500 ml is the tidal volume. Now let's say we ask the person to, this time we ask the person to take in air with some effort, with the maximum possible effort that he can use. So the person takes in air first, the tidal volume, and then this is the additional amount of air that the person is going to take in. With this full effort the person reaches up to this level. Okay, now we ask him to expire all the air, okay, till he reaches back to the normal level. Okay, now during expiration we don't ask him to apply additional effort. Okay, without effort, this expiration is without effort up to this point. Okay, so this additional amount of air, as you can see, this part, this is the extra amount of air that the person has taken in with forceful effort. This is called as inspiratory reserve volume. Okay, so this, the normal one here, this was a tidal volume. Okay, now the additional amount that the person has taken in with some effort, this is called as inspiratory reserve volume. Okay, inspiratory reserve volume. Now this inspiratory reserve volume, its value is almost 3000 ml. Okay, that's 3 liters. Okay, approximately 3 liters is the inspiratory reserve volume. Okay, now let's say we ask the person again to start breathing normally. So normal, tidal volume, tidal volume. Okay, inspiration, expiration, tidal volume. Now let's say we ask the person we ask the person to take in air normally but to expire air forcefully. Okay, so the person is going to expire air first, the tidal volume, and then the additional amount of air that he's going to expire by using his effort. So this is the point that the person is going to reach. Okay, up to this point, so the person first expires normal tidal volume, then this is the additional amount that the person expires. The person cannot go beyond this point. Okay, person cannot go beyond this point. Now this amount, this volume here, the additional volume, this is called as expiratory reserve volume. Okay, now this part below is the residual volume. It will always remain in the lungs. Okay, this will always remain in the lungs. Okay, it's not possible to expire any part of this out. Okay, so the person, no matter how much effort the person makes, he is not going to reach below this point. Okay, it's not possible. The person here can reach up to this point, and then let's say we ask the person to inspire again without using any extra effort. Okay, so again we reach back to this point. Okay, now this here is called as the expiratory reserve volume, and this is the residual volume. Now let's go to this page. So inspiratory reserve volume, its value was almost 3000 ml. Expiratory reserve volume is approximately 1000 ml, and the residual volume is 1.2 liters. Okay, that's 1200 ml. Okay, so these are different lung volumes. First is the tidal volume. As you can see from this diagram, the normal amount of air inspired or normal amount of air expired, so no extra effort. This is just normal breathing. Okay, tidal volume almost 500 ml. Now inspiratory reserve volume is the extra amount of air. So this, from this point the person started inspiring till this point, this was a tidal volume. Now the extra amount of air that the person is going to breathe in by using force, by the effort of his respiratory muscles, so this is called as inspiratory reserve volume, and its value is approximately 3000 ml. Okay, now the person has expired all this. Now again normal breathing, tidal volume. Now the person is asked to expire forcefully. So first the person expires tidal volume, and after that the extra amount of air that the person is going to expire is called as expiratory reserve volume. Okay, this is the expiratory reserve volume, measuring approximately 1000 ml or 1 liter, and the amount of air, this the lower one, it's always going to remain in the lungs. This is called as the residual volume, and it measures approximately 1.2 liters, that's 1200 ml. These are different volumes of lungs. Okay, so here we have the tidal volume, inspiratory reserve volume, expiratory reserve volume, and the residual volume. Okay, now the lung capacity is these can be found out by addition of two or more volumes. Okay, so let me again explain it with the help of the same diagram. Now the tidal volume plus inspiratory reserve volume, this is called as the inspiratory capacity. Okay, inspiratory capacity. Similarly, the inspiratory reserve volume plus tidal volume, inspiratory reserve volume plus tidal volume plus expiratory reserve volume, this is called as vital capacity. Okay, so I'm going to write it here. This is called as the vital capacity. And the amount of air that remains in the lungs after normal inspiration. Okay, normal expiration. So the person's taking in air normally, then expiring normally, normal inspiration, normal expiration, normal inspiration, normal expiration. Now the amount of air that actually remains after normal expiration, that is this part, this is called as the functional residual capacity. Okay, so this part here is called as functional residual capacity. And the addition of all these gives us the total lung capacity. Okay, so these are the capacities which are found by addition of these volumes. So we have functional residual capacity, inspiratory capacity, vital capacity, and total lung capacity. Okay, so these are different lung capacities. Now in the beginning I told you all these can be measured using spirometer, but there are some exceptions. Now the exceptions, okay, let's go to exception part. The only volume that cannot be measured by spirometry is the residual volume. Okay, residual volume, because if you see, the person expires, first takes in air then expires, and residual volume is the volume that the person can never expire, so this cannot be measured using spirometer. And the capacities which contain residual volume in them, they cannot be measured using spirometry. Okay, so what are these capacities? So residual volume here, it's present in this capacity, which is the functional reserve capacity, and it's also present in this one, that is the total lung volume. So these are the two capacities that cannot be measured by spirometry, that's functional residual volume and total lung capacity. Okay, so this was about the lung volumes and lung capacities. Now one important point about this residual volume is this residual volume, okay, this is present in the lungs after the first breath. Okay, so once a newborn, once he has breathed his first, then this residual volume will always remain in his lungs. Okay, now if there is death of a baby, or in case of, if we have to see whether a child who is, in case of a stillborn child, okay, if we have some doubts if the child is really stillborn or it can be a homicidal case, this residual volume, it can actually help us. So what we can do is, in a bucket which is filled with water, okay, so the pieces of his lungs, so we take a piece of his lungs. Now if this piece of lungs contains residual volume, then it's actually going to float. Okay, if it's going to float, it means that the baby has breathed, that means the baby was born alive. Okay, alive. Now if this lung sinks, that means, if this piece sinks, that means there is no residual volume, and this is a case of stillbirth. Okay, so this can be used in forensic medicine for this purpose. Okay, so these are the lung capacities. Let's quickly write their formula. So inspiratory capacity is equal to, again let's refer to this diagram, inspiratory capacity here, inspiratory capacity is equal to inspiratory reserve volume plus tidal volume. Okay, so it's equal to inspiratory reserve volume plus tidal volume. Similarly, vital capacity is equal to inspiratory reserve volume plus tidal volume plus expiratory reserve volume. Okay, as you can see here, vital capacity is inspiratory reserve volume plus tidal volume plus expiratory reserve volume, and the total lung capacity is vital capacity plus residual volume. So total lung capacity is vital capacity plus residual volume, and functional residual capacity, this is the FRC, functional residual capacity is equal to residual volume plus expiratory reserve volume. So this is equal to residual volume plus expiratory reserve volume. Okay, so these are the lung capacities. Okay, so we can find the values of these capacities as well, because we know the values of all these lung volumes. Now another important thing that we should note is the values of these lung volumes, they are slightly greater in males as compared to females. Okay, slightly greater in males as compared to females, so this thing we should remember. Okay, now let's move to another topic, which is called as the dynamic lung volumes. It's also related to lung volumes. Okay, so first of all, functional vital capacity, we already